Hello friends, now I will be talking to you about diabetes ketoacidosis. DKA is a very important topic. A question always comes in final year in theory, and every exam, competitive exam, lot of questions are from DKA. So regarding DKA, first of all, it is a medical emergency. That means patient should be always treated in ICU. Now, DKA, it is an acute complication of diabetes mellitus. It is much more common in children as compared to adults. That's why we can say it is more common in type 1 diabetic patient, but I never mean that it doesn't occur in adults or in type 2. It does occur, but more in children. Now, what are the clinical features by which patient come to us? Patient come with nausea, vomiting, pain abdomen. This is a very important point. Mark dehydration. Fruity smell. Okay. Then on examination, you get tachycardia. BP may be low because of marked dehydration. And we get tachypnea. And classically we get small breathing. Small breathing. This is due to acidosis. This is a key word. This is a very important point. Small breathing is due to acidosis. Fever may be there. Okay. Now, one thing you got to know. Here it is a medical disease, but patient come with severe pain abdomen, just like any surgical emergencies like appendicitis or gallstone. So let us see what are the other medical diseases which can come as severe pain abdomen. So severe pain abdomen. It occurs in DKA, we studied just now. It can occur in inferior wall MI, basal pneumonia, porphyria, Addisonian crisis, these are some of the important medical disease patient having, where patient come with severe pain abdomen. So we come back to our DKA. So in DKA, on examination, we have examined the patient and you got the following findings. Now, what are the lab findings? The lab parameters are, first of all, sugar values are in the range of 250 to 600 milligram percent. There is increased blood urea because of dehydration. So what we can say, due to pre-renal failure. Pre-renal failure. TLC count is raised. This is a very important point. That means leukocytosis is a feature of DKA. It does not indicate infection. Infection is shown by presence of fever. If fever is there, that means infection is there. Then, in this urine ketones are positive. Ketones are negatively charged particle. Due to this, in this patient has metabolic acidosis with increased anion gap. Patient also has pseudo hyponatremia. Now let's learn what a basic concept about pseudo hyponatremia. Any condition, if blood sugar increases by 100 milligram percent, serum sodium will go down by 1.6 milliequivalent per liter, right? So if sugar goes to 600, what I told you, with every rise of 100, the sodium will go down by 1.6 milliequivalent per liter. So pseudo hyponatremia is there. Hyperkalemia occurs. This is due to metabolic acidosis. In these patients, amylase level is increased in the serum. Point to be noted: the child is coming with the pain, abdomen, nausea, vomiting, and amylase is raised. It's not due to pancreatitis, but due to DKA. That's why pancreatitis is best diagnosed by lipase. Lipase is not increased in these patients. Okay. So this was the what we call as lab finding. Now I like to talk about pseudo hyponatremia. So here we are getting pseudo hyponatremia. So what are the causes of pseudo hyponatremia? The other causes are causes of pseudo hyponatremia. DKA I discussed just now. Second is non-ketotic hyperosmolar coma. Non-ketotic hyperosmolar coma. Okay. Third, hyperlipidemia. Multiple myeloma, or any condition where protein is high. So friends, any condition with high sugar like DKA or non-ketotic hyperosmolar coma, high lipid or high protein like multiple myeloma, these are the causes of pseudo hyponatremia. So now we have a patient of DKA to whom we have to admit in ICU. So now how to treat these cases? Treatment. First of all, we give injection. Normal saline. Why? The patient is dehydrated. Why dehydrated? Because of osmotic diuresis. So we give normal saline. Then we give injection, regular insulin. Regular insulin intravenous. This is very, very important point. Point to be noted, the only insulin which is given IV is regular insulin. So where we give regular I for insulin intravenous. Then if some infection is there, then we give antibiotics. Now something very interesting. When the patient come initially, patients come with hyperkalemia. That means potassium level is very, very high, and this is all due to acidosis. So in the beginning it is hyperkalemia because of acidosis, but once we start treating the patient with insulin, now what happened? This is the cell, and due to insulin, sugar will go in, G for glucose will go in the cell, but when the glucose enters the cell, it takes potassium with it as a co-transport. So with the entry of glucose, due to insulin, potassium also goes in. So initially, the potassium level is very high, but as we treat, potassium levels start coming down. So in the beginning, hyperkalemia, later on, normal, and in the advanced stages, even hypokalemia can be there. That's why in the later stage, we may have to give potassium. And remember, best parameter to know about potassium level is ECG. ECG tells you second by second about the potassium level, which can be confirmed by the biochemistry also. But point to be noted, ECG is the best way to monitor potassium level. Right? Now let's see what complication can occur in these patients. Cerebral edema. Is the most dangerous complication. Is common in children. Then other complications are venous thrombosis, it is more common in elderly person. MI, patient can even develop MI, again more likely to happen in elderly person. Then acute gastric dilatation. These are some of the complications of a case of DKA. Well friends, we got many queries about what students want to learn the topics. So, and people wanted more information also, question and all the details. So we have made a forum. You send your details, your name, your college, which year you are, your mobile and email via messenger to us. So we will be